Welcome to this lecture on topical routes of drug administration. A topical route is whereby a drug is administered on an external body surface or on a mucous membrane for a localized effect. That means that there is no intention of systemic absorption. So the topical route is familiar with us and is widely used. We are all familiar with many topical preparations such as eye drops, lotions, oils, shampoos, mouthwashes, creams, and ointments. The list is endless. So today we are going to focus mainly on absorption across the topical route, the advantages and disadvantages of the topical route. Will mainly focus on application of drugs on the skin and unintended systemic absorption. So the topical route is widely used because every day individuals apply a product on their skins. So the topical route has a number of advantages. The first is because drug is applied for a localized effect, the drug is not absorbed systemically, and this minimizes the risk of systemic side effects. The next is that this route is easy to administer. Anybody can apply a drug on the skin and no specialized skills are required. Now we shall focus on drug administration on the skin, and this is also known as the epicutaneous route. There are many reasons why people apply drugs on the skin. The most common is cosmetic reasons. For example, to keep the skin moist and to improve the appearance of the body. So drugs can be applied on the skin to treat various infections, especially fungal infections such as athlete's foot between the toes. Here you can apply powders and many other products. You can also apply on the skin to manage bacterial infections. Drugs are also applied on the skin to treat inflammatory conditions and allergies. Steroids are widely applied for this purpose. Drugs are also applied on the skin to manage ectoparasites. Those are parasites that live on the skin, such as scabies and lice. Next, we shall look at systemic absorption of drugs from the skin. Generally, this is very poor because a drug will have to penetrate the epidermis, which is designed to minimize drug absorption. So, what are the disadvantages of dermal application of drugs on the skin? The first is unintended systemic absorption. Fortunately, this is rare and does not frequently occur. Secondly, some products may cause local irritation or they may trigger allergic reactions. Our next slide will focus on reasons for unintended systemic absorption. So there are 4 factors that can lead to unintended systemic absorption. The first is application of a drug on a very large surface area. If you apply a drug extensively throughout the body, one increases the chances of systemic absorption. Secondly, if an individual has breaks on the skin, which may be caused by cuts or burns or inflammation of the skin, the integrity of the skin is compromised, and this can lead to systemic absorption. Thirdly, drugs that are small molecules and are highly lipophilic are easily absorbed across the skin. By lipophilic, I mean that the drug dissolves well in oil. Lastly, when one rubs the skin, they cause increased temperature on the skin. This causes vasodilation, resulting to increased blood flow to the skin surface, thus promoting drug absorption. In this slide, we shall focus on other sites for topical drug administration. First, we shall start with the eyes. Drugs can be administered in the form of ointments and eye drops to manage various eye conditions. For example, antibiotics can be administered to treat eye infections, or one can administer mediatrix to increase the diameter of the pupils to facilitate examination of the eye. Drugs can also be administered topically in the mouth. For example, toothpaste, mouth washes, gargles, and antifungal drops to manage oral candidiasis. Drugs can also be administered into the ears in the form of eardrops. Administration of drugs into the nostrils is known as intranasal administration. For example, nasal decongestants are administered to treat congestion when one has a cold. Here I have a picture of a suppository, and a suppository is administered into the rectum to manage conditions within the anus or the rectum. For example, suppositories are inserted into the rectum to treat hemorrhoids. Next, we can have vaginal drug administration to treat infections such as vaginal candidiasis. So with this, we have introduced topical routes of drug administration. Thank you.